Hey everybody. I want to talk this time about bipolar disorder and a little bit of the history, what it is, the types of bipolar disorder, because there's more than one, how it's treated, and how you can help your friends and family who may have this disorder. So, bipolar disorder used to be called manic depressive disorder. It's no longer called that, although the mood swings are still referred to as mania or depression. And the mania, it's very intense, high energy and excitement, where the depressive state is very deep sadness and low energy. And they're more than just regular ups and downs in the mood swings. They're more intense, and they can affect school, work, and relationships. So the types of bipolar disorder. There's bipolar 1, bipolar 2, and cyclothymia. So bipolar 1, the mood swings include full-blown manic episodes that may require hospitalization. And alongside that, you have periods of depression. Bipolar 2 includes milder up moods, also called hypomania, and longer depressive episodes than someone with bipolar 1. Cyclothymia, it's milder, frequent mood shifts that last for at least 2 years, but don't fully meet criteria for bipolar 1 or 2. So how do mental health care providers diagnose this with, there's so many variations and not very specific lengths of time. So the manic episodes, when they're interviewing their patient, the manic episodes have to have them describing as feeling on top of the world. Full energy for at least a week or more. They need very little sleep. They are talking fast. They may exhibit risky behaviors and be very impulsive. Hypomanic episodes are the same symptoms but milder and shorter. So we're talking like 4 days or so. 4 to 7 days, I would say. Maybe even 10. The depressive episodes, the sadness, fatigue, sleep problems, the feeling of hopelessness lasting 2 or more weeks. And of course, doctors are ruling out other causes like substance use or medical issues. So what exactly do these symptoms look like? So in the mania or hypomania, you're going to have someone who's talking a lot, sometimes talking super fast, feeling super confident, like they can do anything. Nothing is stopping them. They can do whatever they set their mind to. They need very little sleep. They have lots of energy. Then you may see them not sleeping for days. They are making very, very impulsive decisions, like spending sprees, maxing credit cards, taking risky behaviors, which may include things that outside their norm, just very, very risky in terms of sometimes drug use, sexual exploits, those kinds of things. The depressive side, they could be feeling very sad, feeling very empty. They could be tired all the time. They cannot sleep enough. They may have trouble concentrating, sleeping too much or too little. I know it's crazy on the flip side of being tired all the time, but sometimes when you're depressed, you want to sleep all the time, but you can't. And again, they may have thoughts of death or suicide in this depressive state. So what kind of medications do we use to treat bipolar? We use mood stabilizers, antipsychotics, and antidepressants. So the mood stabilizers usually include something like lithium or valproate or valproic acid. They help prevent the extreme highs, those mania episodes, and they help prevent the depressive episodes. And they keep your mood more balanced over time, which is exactly what it says in the name. It's a mood stabilizer, so it's more even. Antipsychotics, which we've talked about before, like quetiapine, olanzapine, and risperidone, they're often used when someone is very manic, agitated, or experiencing confusion or hallucinations. And this you would see in the mania episodes. It can also be used during depression, but it's always an adjunct to the mood stabilizer. And some antidepressants are used. Most of the common ones that we've talked about before in major depressive disorder, but they're always paired with a mood stabilizer to avoid triggering mania. And that's one of the tricky things when you're diagnosing and treating bipolar is you can't just give someone an antidepressant in their depressive episode if they're bipolar, because you could trigger a manic episode. And then you're trying to play catch up and treating the mania and restabilizing them with the correct medications. But sometimes it can't be helped. They may not seek treatment in their manic episodes because they feel great. They're on top of the world. And they don't feel they need help when they're in a manic episode. Only when they're in their depressive state do they feel that they need help, or that's when friends and family make them seek help. Common side effects of these medications: weight gain, tiredness, shaky hands, which could be with the lithium. Lithium and valproate require blood level monitoring. Lithium has a very narrow window for toxicity, so that's something to keep in mind. Another side effect: feeling sleepy, restlessness with the antipsychotics, maybe some upset stomach and anxiety with the antidepressants. So when does someone with bipolar need to be treated inpatient in the hospital? If they're feeling suicidal or out of control, if they're hallucinating, seeing or hearing things that are not real, they can't take care of themselves. They're not eating, they're not sleeping, they're making poor judgment decisions, and they just are not safe. And if their medications need to be safely adjusted. So how can you help if you're their friend or family member? Be supportive, not judgmental. Learn about their condition. Help, stay calm to help them stay calm during their mood episodes. Encourage them to seek treatment, especially if you think they require hospitalization. You need to give them some strong encouragement, but don't force it. And be part of their safety plan. So once they're medicated, they will make a safety plan. If they're inpatient before discharge, be part of that plan. Let them know that you're a safe person that they can go to. And bipolar disorder is treatable. Very, very treatable. People live with it every single day, lots and lots of people. And with the right support and care, they can live full, healthy, stable lives. But if you notice that your friend or family member may be exhibiting any of these symptoms, encourage them to talk to their provider or seek treatment. And again, the suicide crisis lifeline is 988. If you or them or someone you know needs that number, if they're feeling that hopelessness and helplessness in their depressive episode, give them a call, text. It can save a life. And again, thank you for watching. Please like, share, follow, and subscribe for more. And I'll see you all next time.